Okay, we are going to show you step by step how we are making a guided implantology placement. On this case, we are going to place an implant in position 1, 2 and 2, 1. Okay, on these two implants, we don't take care of the back. So what we receive a surgical guide, and we receive the guidelines. In the guidelines, we are going to go to 12 and to 21. Okay, we have different measurement here. We need to make a drilling at 24 millimeters, and it is wide. And wide, I will explain to you why I take wide. And drilling extension, nothing. And this is the length of the implant driver if we want to drive the implant placement accurately. So based on these two, we will use a Master S implant. I am going to place an implant and I will show you how to do. So we are going to work on the implant number 2, 1 on the upper lateral central incisor. We put the implant in a mix of water and betadine. Betadine like this. Okay? So when this is done, we can use that. Use the suction to clean it up. And this is what we're going to do. We place it in the patient's mouth and it will come perfectly in place on the teeth, and we control that the teeth are correctly placed down to the bottom, and we look at this to check the position of the implants. So I am going to drill in this position, and to do that I am going to plan the position of these retention screws. So I will work on this, this and this. Most of the case it's not needed for partial cases, but in this case I will show you all the way we do. So next step will be the placement and the secure placement on the model. I'm going to select a drill. The drill is 2 millimeter in diameter. I take one and I am going to go to the drilling. This is the drill, this is the implant motor, and we are going to drill at 2000 rotation per minute. We go now on that. Okay, it's in good position, and I go down to the bottom. I go down to the bottom. I go down to the bottom. This is done. So when this is done, we are able to place that in a very secure way, and I don't need to hold it anymore. It is stable. Once again, we do these cases for full cases. Partial cases, most of the time we do not need that. So I am going to place an implant in this. The implant we selected is this implant. This implant is a Master S 3.75 by 10. Okay. So this means that I need an implant which is wide, and we're going to use a wide opening. Okay, the wide opening is here. You have a wide trephine and regular trephine. We are going to use a wide trephine. If we need, because it's not deep enough, we can use an extension. So now we use the extension, and you use that, and I go to the patient's mouth and I drill. Okay, you see what I do? I'm drilling like this, and I drill until I feel I'm in the bone. Okay? Voilà. This is the access. So I don't need this. I am going to open, and I'm going to see what's going on here. So here, I don't know if you see, but we have that. We remove with the trephine, with the we remove with the ronger, we remove that. If it's not removing well, we are going to use that in a different way. You use this and you rotate back and front and right and left and back and front until all this is free and until I can remove it easily. So then to do that, I take the, voila, we've been removing it and it's removed. So what I can do also, I can use a blade and I can go inside like this to carefully remove all. We should not leave any soft tissue. So in this elastic tissue it's a little difficult, but imagine in the patient's mouth it's very easy to do until you reach the bone. And now you see that we are reaching the bone. Okay? As long as we have the bone, we can place that back. We can stabilize. 1, 2, 3. We are sure like this that all the step by step will be done in one good way. So now I am going to take a spoon. The spoon will come here. I am going to take a drill, and on the guidelines it's 21 millimeters. So I put that wide here. I put the drill here. I don't need the extension, it was just to show you. And I am going to drill properly in that. So irrigation, and we go down to the bottom. You see, I am down to the bottom. I don't need to go up and down and up and down. I remove it, that's it. So when this one is done, we've been drilling at 2 millimeters. This is the diameter. My implant is 3.75. So what I'm going to do, I am going to go to the next one. 21, next one. I go now to 2.85. I am going to put again that back. I put the 2.85, and I'm going to drill. And I go down to the bottom, one time, that's enough. I can remove it, and I'm going to go down to the next one. The next one will be 325. I drill at 325. I go on the 3.25. I have the wide, and I'm going to place the drill down to the bottom. That's it. Finished. My drilling is done. At this step, we have two options. Listen this, it's very important. So, we have two options. So now we get access to the bone, and if the bone is very dense, you can use a tap to tap the implant size. You see the tap here? So you have a tap, but the tap is done for cylindrical implants. If you have an implant which is a master C, which means this is conical implant, you need to use a countersink, okay? If the bone is very dense, use that before you place the implant. If the bone is not very dense, it's okay to do like this. If the bone is dense and you place the implant, you will be too tight and you will not be able to go down to the level of the bone. So be careful. The technique is different if you have dense bone or not dense bone. Now we are going to place the implant. So we open the implant We open it. We have it inside. This is very easy to use, and I am going to show you how we're going to connect the implant. So we take an implant holder, and we are going to place this implant holder here. And now I am going to remove that and get access to the implant. I put it in, and then I go. It's done. The implant is positioned. If you want to go a little slower, you can do it. And the implant is exactly at the good position. Then we are going to select a healing abutment, or what we can do also, we can select the screw, cover screw, or the healing abutment which is in the patient's scalp. Okay, wait a minute. I am going to take a cover screw to show you first. I remove it, always the same thing, very easy to manipulate. And I go on top of that, and I can put the screw on top. The work is done. You can make an X-ray, you can check all that position, but the work is done. What I can do also, instead of doing that, I can place a temporary crown. So I am going to top of the screw, I remove it to show you the second option. The second option is to use a healing abutment. So I use the healing abutment. This is the one. I place it, and I have the healing abutment. So this is the option number 2. I have another option. At this step, I am going to remove that. In this case, I am going to wait. Now I take a pickup impression coping. I put it on top of the implant, and I can take an impression. And this is the pickup impression coping, which is exactly in the good position. It's emerging in the single arm of the teeth, and you have the implant, which is great in between the roots of the adjacent teeth. We take the impression at the time of the implant placement, and we have 2 months, 3 months for the upper to fabricate the crown. And when the patient will come for validation of its implant, then we will be able to immediately place the crown. No need to take a late impression, anesthesia, or whatever. It is very simple to do it like this. The only thing is that we need to be sure that the implant will take, and more or less we have 3 implants that fail out of 100, so it's a good option to do like this. Thank you for your attention.